Hey guys, so I just wanted to demonstrate with a TheraBand here how the Linea Alba is influenced by the way that our rib cage position is, and then ultimately that it's going to have some sort of effect down onto the pelvic floor as well. So if we think about that Linea Alba, the Linea Alba is the connective tissue lining between the two six-pack muscles. During pregnancy, the Linea Alba gets very stretched out, and it makes a lot of sense. We need some growth and movement to happen somewhere inside of the core system here. So it's absolutely going to be happening through that Linea Alba there, as well as some of the muscles, the six-pack muscle and our obliques. Everything does generally get more stretched out all around here. So why this is important is because postpartum, we do want to set ourselves up for optimal healing, and where our rib cage position is going to affect this tissue through here. So taking this TheraBand, I'm just going to place it right at the bottom of my sternum here where that Linea Alba generally starts, and then it comes all the way down to my pubic bone. So we have that tension through the system just normally here. Now as the baby grows, I'm going to get a stretching through that system there. So now it's more stretched out and actually a little bit more thinned because it was stretched. Just think about a rubber band. So postpartum, once that baby we have delivered, we want to make sure that we think of keeping that rib cage position down a little bit more to help take out some of that tension going through the system. So really common when I'm holding my baby to kind of be back in this sort of a position here where now my rib cage is arched and flared. It keeps that tension in that Linea Alba there. If I do think of, okay, just rib cage down slightly, I don't have to come all the way down forward here and just kind of feel really, really tight. But if I'm just kind of mindful of slightly down, so I'm getting out of tension and then just slightly down, that's going to help promote optimal tissue healing for my pelvic floor and my abdomen. And then also where that pubic bone ends, where that Linea Alba ends, if I'm tipped forward a lot, that's also going to affect that tension through that area too, increasing more pressure potentially on that Linea Alba. So I do want to think, okay, just a little bit of pubic bone slightly coming towards my sternum there, just a little bit. It's not a lot. Again, I'm not crunching and totally being here, just thinking slightly down with my rib cage. So laying down here, you might find that you're really flared already. So if you need to, you can take a pillow, just prop it right underneath your head, and that's gonna relax this upper core a little bit more. I'm just gonna leave my pillow here for now. So again, taking that TheraBand, thinking of that sternum, pubic bone. So the whole idea with this is that we're keeping that same tension through there without arching into this position. I'm gonna I have just a stick here, you can really use anything. And just not a lot of resistance with this one. I'm just focusing on that connection here. So I'm going to be bringing my arms up overhead while thinking of that pubic bone connection to my sternum as I reach my arm over. And I'm just going to where I feel like I can go without getting that arch coming into my back. So right now, if I went all the way to the table, I can get there with keeping that connection. It's a little bit challenging, but I can do repetitions of this where I'm just practicing sternum to pubic bone. I'm really not trying to allow this posterior just tilting of my pelvis backwards. I'm really focusing this on the front side of my body, connecting there.
Okay, so we can also work on this sternum to pubic bone connection on our hands and knees during doing a bird dog exercise. A lot of people tell me that they think bird dogs are really easy, but they're actually really challenging. So what I recommend to do with this one is once you're on your hands and knees here, when you reach your arm away, definitely don't do it so much that that chest wants to come forward. Really think of that, again, sternum connection with the pubic bone. So as I bring that arm up, sternum to pubic bone, back down. And then I could swap, keeping sternum to pubic bone. And I could advance that with sternum to pubic bone and then even alternating sides here. Again, I am reaching long, but I'm not overly reaching here. I'm keeping that sternum down towards pubic bone, down towards pubic bone, all right? So try to have that laying down, and even on your hands and knees, you can come up and modify this a little bit more, or advance it a little bit more. So I have my back up against the wall, so I'm not trying to allow myself to flare here. Again, I'm connecting that sternum to my pubic bone. And then from here, I can bring my arms out to the side with keeping that there, raise my arms up with keeping that connection. Then bring those arms back down. So I'm not letting my back come farther away from the wall, and I'm also trying not to let my elbows and hands come away from the wall here. I'm just sliding right along that wall. The higher up my hands go, definitely is gonna be the harder. So if you feel a huge tug in your back, that's about as far as you're going. And I'm not trying to do this with my shoulders too, keeping those shoulders down away from the ears as I just slide up along the wall. This is really hard, and then sliding back down.